Hello. Let's take a look at how we can write proper therapy orders. We get our guidance from Chapter 7 of the Medicare Benefit Policy Manual, which says orders have to be specific. They must indicate the type of service provided, both with respect to who's doing them and the nature of the services, including the frequency of services. So here's an example from the Benefit Manual that says skilled nursing 7 times for the week, for 1 week, 3 times a week, times 4 weeks, etc. Then it lists the type of interventions that are going to be performed. Palmetto is the intermediary between Medicare and the agencies in the southeast part of Florida. They also have further guidance, which has services are to be furnished according to the plan of treatment that is determined by the physician after a therapist or somebody they've consulted with, and that the doctor will sign the order after the evaluation of the therapist. That the treatment must be completed, or the plan of treatment must be completed before therapy begins, which means you have assessed the patient and determined what kind of interventions you're going to do, as well as contacting the doctor's office to inform them and get a verbal okay for the therapy. The plan of treatment may not be altered by the therapist. That means if you change any part of that treatment, such as the frequency, duration, interventions, then you have to notify the physician and get an order to correct it. So, what things do they expect to be within the order? Diagnosis, being treated, specific problems are being addressed, treatment techniques, such as modalities, gait, transfers, ADLs, etc. The goals have to be on there that are measurable in objective terms. The frequency, duration of services, and discussion of the rehab potential and the person's ability to meet those goals. With regards to doctor's choice, we write our orders on the Medicare week Sunday through Saturday. The effective date is going to indicate the date that the order first comes into effect. And the first number is the frequency, and the second number is the duration. Therefore, twice a week, 2W2 means twice a week for 2 weeks. Here's an example of a therapy order: physical therapy to instruct the patient on gait training, neuromuscular education and therapeutic exercise is effective this date, and this is a frequency. If you're writing orders for modalities, you have to have much more information. You want to think of the modality order just like a medicine. You want to think, what kind of modality are we doing? Where are we going to apply it? The reason for it, frequency and duration of that specific modality, and then the dose. A note on frequency duration. This does not mean when you put a frequency for your therapy visits, this matches the modality. You want to put a specific frequency for the use of this modality, which may be less than the frequency of your visits. So let's take a look here. I'm writing an order for ultrasound. Ultrasound to the shoulder, increasing range of motion, that's the purpose. Here's the frequency for it. There's the duration and time with an intensity range here. If you're seeing the person 3 times but only using it 2 times, then state 2 times. Electrical stimulation, same thing. What type of modality, location. In this case, it's written for PRN, says to apply when pain is greater than 5 out of 10 for 20 to 30 minutes with an intensity here. So if you're going to use as needed, have a trigger that would indicate the as needed. So if you have pain, you may only use it after a certain level of pain is reached. If you're using any type of cold packs or instructing in that, make sure that you indicate the location, how often, and for how long you're going to do that. And if therapy is going to use biofreeze, which is a very common menthol treatment, you need to indicate where that is going to be applied and have an order for that. You cannot apply that without a doctor's order. If the patients had that product before on their own, then that's fine, but we don't want to reinitiate it, then we have to have an order to apply it. When making up missed visits, you want to make sure that you write an order to make up those missed visits, which can be done a couple ways. You can do it during a reevaluation or a modification order. If you use a modification order, you must include the components of the order, such as the discipline, the effective date, interventions, and the frequency and duration that you're requesting. If you're adding a goal for that order that wasn't on the plan of care, then you can put that goal on the order as well. Make sure it's specific, measurable, and functional. keep in mind that don't state the reason to make up a missed visit is to make it up. That's not a reason. It has to be something specific to the treatment you're working on. You want to educate the patient on home exercise program and gait training with walker, something along those lines. Now let's take a look at our EMR system and how you complete orders within the system. Now we're going to take a look at our computer system and how to write orders within the documents. So for therapy, you're going to have an evaluation, a reevaluation, or a modification order. So when you do your therapy evaluation, that is going to become an order into itself. You don't have to write a separate order after the evaluation. Now I'm simply just going to put a basic information in the time and the date so that I can proceed. And we're just going to focus on writing an order. We're going to go into the Progress Goals dashboard here to look at how you add the specific intervention or the services you're going to provide. But before we do that, this is where you add your frequency and information in here. So all I have to do is I'm going to pick the effective date, and we'll just pick this date here. And I can write my frequency as such, just like we saw in the other prior information. Nice thing in Kinzer or Welsh Guy, you can click on this calendar and you can open up and look at a calendar that allows you to figure out how you're going to do your frequencies. Can't do anything on the calendar itself, but it can be helpful when you're planning. Remember, after therapy evaluation, you must call the physician and notify them. Click this box here, and you can type in this information here. I have my computer pre-defaulted to this. And maybe I spoke to Cheryl at Dr. Butt's office at this time and date. This is the information you need to have here. If for some reason you didn't speak to somebody, because often we get automated systems, these days you can put this indicator here. Now, we still need to have a call back from the doctor's office or somebody saying that they received this order and it's okay. So in this case, this is fine. You can put this here to show that you called, but we'd want to have a follow-up documentation when that office calls you back that says, yes, I got the order and the doctor is going to sign. The best thing to say when you're calling for an order is your name and that you are going to provide this type of service, and ask that please verify that the physician is going to sign the orders for occupational therapy, speech therapy, physical therapy, what have you. That way, please call me back. That way you have you're indicating that this doctor is actually going to be the signing doctor. Sometimes those doctors that are listed may or may not sign the orders. So this is a way to confirm that we have the right physician, as well as following the guidance from the regulatory bodies that we must call the doctor to verify our order. So here you have your frequency, duration, your effective date. We already know in this case it's a physical therapy note, but your interventions or the treatments in the case of this system will be put in when you create your goals. And I'm not going to spend time on the goals there, but we're just going to pick one real quick so we can show you. I have my goal here, and for the sake of time, I'm just going to fill these fields so that I can have something in here. Again, there's another video how to use progress to goals. But down here is your interventions. Now, if I like these interventions, I can keep them, and I could fill in if I have to write something in there or type something in there. Or if I don't want to keep them, I get rid of them here. Once I have this information and hit assign, those become your interventions there. So now you have all the components you need for your order. You have the frequency, duration, and the other note, and then you have your interventions here listed. If we go into a reevaluation, exact same format, you have to have your time, date entered, and as I would go into the progress goals dashboard, I can do the interventions like I just showed you. Now on a reevaluation, if you're not actually changing anything, you don't have to put anything here. You can leave it blank. You don't have to put an effective date. If you have orders that are already current, there's no need to do anything in these boxes here. If, for example, you reevaluate and you see you're extending the care or adding on visits after maybe there were some missed visits, well then you would certainly want to indicate a date of the effective date and the frequency listed there. And in addition to that, if you're going to update any goals or interventions, you can enter into this dashboard, and you could certainly add them in from there. The one thing on a reevaluation you want to take notice of is that if you're just going ahead and reevaluating because it's part of our conditions of participation, and you're not adding anything, you're not changing the plan of care at all, make sure you check this box here. This way it does not become an order that goes to the doctor. In the case where you did change the plan of care, like you're adding more frequencies or changing interventions, well, certainly you would not click that, leave it open so that the evaluation or the reevaluation becomes in order. The last thing we're going to take a look at is, let's say you're not doing a reevaluation or an eval. Maybe it's not time to do the reeval, but you're writing a modification order of some sort. Once you click into this order, you have to fill in certain information to proceed. And if I want to, here I could simply write something like that. I have the component of who's doing it, the type of intervention, the frequency and duration, and the patient's name would be associated with this, so you have all the components there. And if I could call the doctor's office, I can put even a time there, and I can hit submit. If I want to go in and update a goal or intervention, I have to hit the save, and I have to hit that little save button. And make sure you're selecting PT. Then I can go into the progress to goals dashboard. And again, in here you can go ahead and add a new goal, or maybe somehow I wanted to modify this goal in some capacity. I can do that. And that's how you use progress to goals to write orders, as well as using our EMR system to write orders in your evaluation. If you have any questions, talk to the director. Thank you very much.